Hey there, healthcare professionals. Today, I'm diving into how nurses can effectively manage pleural effusion and empyema. Ready? Let's get started. First up, pleural effusion. This is when excess fluid accumulates between the layers of the pleura outside the lungs. Effective management involves assessment, monitoring, intervention, and patient education. Gather a detailed history focusing on symptoms like dyspnea, cough, and chest pain. Check for potential causes such as heart failure, pneumonia, or malignancies. Inspect for signs of respiratory distress, palpate for decreased tactile fremitus, percuss for dullness, and auscultate for diminished or absent breath sounds. Assist with chest x-rays, ultrasound or CT scans. Blood tests and pleural fluid analysis may also be necessary. Regularly monitor vital signs, respiratory rate, oxygen saturation, blood pressure, and heart rate. Keep an eye out for signs of hypoxia and respiratory distress. Administer supplemental oxygen to maintain adequate oxygenation. Position the patient in a high Fowler's position to facilitate easier breathing. Assist the physician during thoracentesis to remove excess pleural fluid, ensuring a septic technique to prevent infection. Monitor for complications like pneumothorax or re-expansion pulmonary edema. If a chest tube is inserted, ensure it's functioning correctly, monitor the site for infection, and keep the drainage system below the chest level. Educate the patient about the condition, its causes, and potential treatments. Teach them how to care for the thoracentesis site or chest tube and advise on signs of infection or complications. Instruct on managing underlying conditions like heart failure or liver disease. Imagine a patient with congestive heart failure develops pleural effusion. Nurses would monitor fluid balance, manage medications, assist with thoracentesis, and educate the patient on a low-sodium diet and fluid restrictions to prevent recurrence. Next, empyema, which is a collection of pus in the pleural cavity, typically resulting from pneumonia, surgery, or trauma. This requires more intensive management. Assess for symptoms like fever, chills, cough, and chest pain. Check for recent infections, surgeries, or injuries. Look for signs of infection, respiratory distress, and chest tenderness. Note any changes in breath sounds. Prepare for chest x-rays, Connecticut scans, and pleural fluid analysis to confirm empyema and guide treatment. Closely monitor vital signs for fever, elevated heart rate, increased respiratory rate, and decreased oxygen saturation. Assess for signs of worsening respiratory distress or failure. Administer prescribed antibiotics and monitor for effectiveness and side effects. Assist with chest tube insertion or surgical drainage. Ensure a septic technique, monitor drainage output, and assess for complications. Provide pain relief to facilitate deep breathing and coughing. Educate on the importance of completing the antibiotic course, maintaining hygiene, and monitoring for signs of recurrent infection. Instruct on caring for the chest tube site and the importance of follow-up appointments. Advise on measures to prevent respiratory infections, such as vaccination and avoiding exposure to respiratory pathogens. Take a patient who develops empyema following pneumonia. The nursing team would administer IV antibiotics, assist with chest tube placement, manage pain, and educate the patient on infection prevention and the importance of completing the antibiotic regimen. Remember, interdisciplinary collaboration with physicians, respiratory therapists, and other healthcare providers is crucial for optimal patient outcomes. That's it for today. Stay informed and keep providing the best care possible.